Welcome to the deep dive. If you feel like you're just swimming in this sea of information about artificial intelligence, well, you're definitely not alone. Our mission here is really to be your chart through those waters. We extract the essential knowledge, the insights you need to understand where AI is genuinely making an impact, especially in really complex fields. And today, we're undertaking, I think, a pretty critical deep dive. It's about the convergence of AI and modern medicine. Our sources are suggesting that 2026 isn't just another roadmap year. It seems to be the year healthcare leaders are actually moving AI from, pilot projects into real-life, life-saving systems. So we're going to break down exactly how modern healthcare teams are using this tech, how they're delivering faster, safer, more personalized care, and crucially, doing it all while keeping that essential human connection, the thing that really defines good medicine. Oh, and before we really jump into the mechanics of all this, this deep dive is brought to you by AI Opportune. Think of AI Opportune as your fast track to the future.
It's where ideas meet innovation, where ambition really turns AI into action. So whether you're leading a team, maybe strategizing for growth, or just looking for some clarity in this incredibly fast-moving AI world, AI Opportune is there to guide, inspire, and equip you with trusted insights, specialized tools, and importantly, real-world success stories.
Yeah, and I think it's vital we frame this conversation correctly from the start. We're entirely past the hypothetical stage now. This isn't just some abstract idea about tech supporting healthcare. No, we're talking about sophisticated, deployable systems that are fundamentally altering workflows and, yes, saving lives. We're seeing things like dramatically earlier cancer detection, round-the-clock predictive patient monitoring. These are concrete operational changes, and they really demand that leaders act now.
Okay, right. So let's unpack that core thesis from our source material then. The fundamental shift, it seems, isn't AI replacing doctors. That's the headline you sometimes see, but it's not quite right. It's more that AI is giving hospitals, clinics, caregivers the tools they need to achieve what maybe was previously impossible. Acting faster, thinking smarter, especially under immense pressure.
Exactly. It is an empowerment story for clinicians at its heart.
But that empowerment narrative, as powerful as it is, brings us right to a crucial constraint, doesn't it?
It does, and this is key. AI is only truly powerful, truly beneficial when it's paired with human empathy and clinical expertise. That's non-negotiable. If you try to implement it just as a tech efficiency driver, purely for speed or cost savings,
You lose the patient focus.
precisely, you lose that patient-centric focus. The moment we forget that human oversight, that compassion is necessary, the technology risks becoming a liability, not the asset it should be.
Okay, so keeping that balance in mind, where are we seeing the immediate practical applications? You mentioned scaling smart care right now.
Yeah, when we look at the ground level, we see AI making an immediate impact across really 4 distinct pillars. First, diagnosing faster and, importantly, with significantly improved accuracy. We're talking radiology, pathology, genomics fields where pattern recognition is just paramount.
Okay, diagnostics. What's number 2?
Second is predicting patient risk. So allowing clinical teams to intervene hours, sometimes even days, before a serious medical emergency actually strikes, catching problems early.
Right, the proactive element.
Yeah.
And the third and fourth points, you mentioned efficiency and access earlier, which are, massive system challenges.
Absolutely huge. So the third pillar is automating that overwhelming administrative overload. Sources suggest doctors, nurses, they spend maybe up to a third of their time just on paperwork. Imagine freeing that up.
Oh, a third.
Yeah. So automating scheduling, billing, documentation, that's a massive efficiency gain. And it translates directly into more time spent bedside with you, the patient.
Makes good sense. And the fourth?
Fourth is extending care reach. This is so critical for, say, rural or underserved communities. AI enables remote monitoring, better telehealth infrastructure. It allows specialists to connect with patients across huge geographical distances.
Okay, let's dedicate a bit more time to those front lines, specifically the sharper diagnostics. You said faster analysis. But let's get into the how. How is AI looking at medical images so quickly? Because understanding the technical grounding here is probably important for you listening. We see platforms like Google Health, Zebra Medical Vision. They're interesting. They specialize in finding those often missed incidental findings on X-rays, CT scans, and Path AI focusing on digital pathology slides. These aren't just scanning images, right? They're
Sure.
using deep learning models, CNNs, convolutional neural networks,
Exactly. Trained on millions, literally millions, of labeled images.
which lets the AI spot tiny things, subtle anomalies.
That's right. Things like microcalcifications in a mammogram or maybe minute cellular irregularities on a slide. Things that even a skilled but perhaps fatigued human eye might miss after hours of reading stands. And that ability, that capability to serve as this tireless, high-precision second opinion, well, it's transformative.
The benefits seem pretty clear then.
Oh, absolutely. Earlier cancer detection, for one, a tangible reduction in misdiagnosis rates, and just hours saved in manual scan review. And if you connect that to the bigger picture, this shift towards preventative real-time care. Arguably, it's the biggest systems transformation happening right now.
You mentioned preventative care. Let's pivot to that safer patient monitoring. We're moving away from just reacting to a crisis towards something more proactive, continuous passive monitoring, I think you called it.
Precisely. Continuous passive monitoring, or CPM. We're talking about AI-enabled wearables, sensors. Think beyond just basic step counts or heart rate. Companies like Current Health, Biofourmis, Philips with their IntelliVue system. They don't just collect basic vitals, they establish a deep physiological baseline for each individual patient.
Okay, a baseline. Then what?
Then they use machine learning models to spot minute deviations from that specific person's normal state. The real intelligence, the AI part, comes from flagging subtle changes. Maybe it's a specific shift in heart rate variability combined with a tiny drop in blood pressure. Things that individually might not raise an alarm.
But together,
Exactly. Together, the AI flags it and alerts staff maybe 24, even 48 hours before those markers hit a critical, dangerous threshold. I read one source describing a pilot program. AI successfully caught developing signs of sepsis. I think it was 40 hours earlier than the standard hospital protocol would have.
40 hours. That's incredible.
It shows how far we've moved beyond just simple alarms. This is genuine predictive safety. And the so what here is really compelling. Hospitals using these tools, they aren't just cutting down on expensive readmissions, although they are doing that. They are actively saving lives. They're significantly improving long-term patient outcomes because they can intervene at the absolute earliest sign of deterioration.
Okay, these clinical improvements are really compelling. But, the true measure of momentum, especially in healthcare, often comes down to the dollars and cents.
Yeah.
If you're still wondering if AI in healthcare is just, hype, given some of the lofty promises we hear, well, the data seems to say otherwise. We should probably anchor this in some specific stats. Show how real this institutional shift is. The financial incentives alone are enormous. That McKinsey 2026 update, it suggests potential annual savings in the U.S. healthcare system of around $180 billion.
Yeah.
Just through AI efficiencies.
Wow.
Mostly driven by that administrative automation we talked about earlier.
Yeah.
Cutting down the paperwork burden.
$180 billion. That's
But
significant.
it is. And the investment is real, too. Gartner reports that 78% of healthcare delivering organizations are actually putting money into AI this year. That shows pretty broad commitment across the sector.
And those investments, crucially, seem to be translating directly into clinical improvements that, justify the spend. We're seeing recent global clinical studies showing that when AI is paired with human radiologists not replacing but pairing diagnostic accuracy for something like breast cancer, gets a boost, maybe 10 to 15%.
That's a real number.
It's a tangible improvement in patient safety, and that builds trust in the system, which is vital. But this surge in investment does raise an important question, a challenge, really, that leadership has to tackle.
Which is?
Who actually bears the initial cost? Implementing these massive data-hungry AI systems isn't cheap. Is this only going to be viable for the large, well-funded hospital networks? Could it potentially widen the access gap between the haves and have-nots?
That's a serious concern.
And beyond cost, there are complex technical hurdles. Things like data standardization, interoperability between different hospital systems.
Yeah.
Those need solving before these systems can truly scale effectively everywhere.
Right, that's a critical point. The efficiency gains only really happen if that foundational data infrastructure is solid.
Okay, but let's shift back to the irreplaceable element here, the human touch. If AI is handling so much data, so much prediction, where does the clinician fit? What's their essential role now?
Well, the clinician becomes absolutely essential for contextualizing those AI insights. An algorithm might flag a patient as high risk for readmission, right?
Okay.
But the algorithm doesn't know why. It doesn't know that patient missed their medication because, say, they lost their job and couldn't afford it, or they don't have transportation to the pharmacy. AI can't, hold a patient's hand. It can't break bad news gently. It doesn't understand the cultural nuances that heavily impact how people approach treatment or follow advice.
So context and compassion. Exactly. And clinicians remain essential for making those tough ethical calls, the ones that always come up in life or death situations. The algorithm might provide a risk score, a probability, but the human decides the actual course of action, weighing everything. And maybe most importantly, they build that essential trust. With patients, with families, you trust a person, not just an output. So the key takeaway really is that the smartest, most effective care systems moving forward are the ones that successfully blend that tech efficiency with genuine human compassion and seasoned professional judgment.
This really sets up a critical challenge then, defining that path forward. It's clearly not about choosing 100% tech or 100% human. It's about this rise of hybrid healthcare.
That's the model. The best performing hospitals looking towards 2026 and beyond, they're actively building these hybrid care models right now. And they're defining the roles with almost surgical precision. AI handles the heavy lifting on data analysis, the predictive modeling, the routine alerts tasks needing speed, consistency, pattern recognition.
Okay, AI does the data crunching.
Right. And that frees up clinicians to focus exclusively on what humans do best. Complex decision-making, creative problem-solving, direct patient interaction, empathy. But crucially, and this can't be overstated, this requires a massive investment in training. They're training their teams to have genuine AI literacy.
AI literacy, what does that mean in practice?
It means clinicians need to know not just what the AI recommends, but understand how it likely arrived at that conclusion. They need to grasp the model's confidence scores, its potential error margins, and critically, know when their own decades of clinical experience should perhaps lead them to question or override the algorithm's advice. It's about collaboration, not blind trust.
So it's intelligent augmentation, not replacement.
Precisely. This model of coordinated intelligent care, it's happening now. It's driven by a need for both safety and scale in modern healthcare.
Okay, so let's bring this home. What does this all mean for you, the listener? Maybe you're an innovator, a leader, just someone trying to understand this shift. The choice seems pretty clear. Based on our sources, you can kind of wait and watch, maybe try to play catch up later when the standards are already set by others, or you can lead. You can start building these integrated hybrid systems now. And the evidence suggests that healthcare teams embracing AI today, they are realizing those better patient outcomes, they're seeing significantly fewer errors, and maybe ironically, they're forging more meaningful patient relationships.
Because the tech takes the burden away.
Exactly. It takes that administrative and heavy analytical burden off their plates, freeing them up for the human side of care.
Absolutely. The transformation is here. Healthcare delivery is becoming data-driven, yes, but hopefully also more personalized and humane because of it.
And looking even further ahead, the sources hint the next wave won't just be in the clinics or hospitals. It might reach right into the research lab itself. How will the next generation of AI, maybe generative AI, impact medical research? Could it lead to faster clinical trials, more efficient drug discovery, better analysis of complex genomic data for truly personalized medicine?
That is a huge opportunity.
It feels like a whole other deep dive waiting to happen.
It really does. That research implication alone, cutting years off drug development timelines, that's profound. And, for listeners wanting practical tools right now or trusted insights, real-world AI strategies you can actually apply today, remember to subscribe to AI Opportune. We're really committed to guiding you with resources. Things like lists of the best AI tools for diagnostics, platforms for that predictive patient monitoring we discussed, and even detailed guides on exactly how to train your healthcare team for this new hybrid era.
Real-world AI insights straight to you. Definitely subscribe to AI Opportune. Join that growing community that's turning curiosity into real capability. The next breakthroughs are just around the corner. We'll catch you on the next deep dive.